There's a virus called HMPV, which is short for Human Metapneumovirus. It can make people sick, kind of like a cold. Usually it's not a big deal, but it can be tough on babies, older folks, and people who don't have strong immune systems. Lately there have been a lot of HMPV cases in China, and that's making people worry. It's a good reminder that we need to know about HMPV and how to stay safe. Viruses like this can spread quickly, so knowing how it spreads and what we can do to prevent it is really important. Staying up to date on HMPV and other viruses, especially when they're spreading a lot, is a good idea. Scientists in the Netherlands first discovered HMPV in 2001. This discovery was a significant milestone in the field of virology and respiratory medicine. They were studying kids who had breathing problems. These children were suffering from severe respiratory issues, and doctors were puzzled about the cause. Finding HMPV was a big deal because it explained why some people were getting sick when doctors didn't know why before. This breakthrough provided a new understanding of respiratory illnesses and opened up new avenues for treatment and prevention. HMPV is related to another virus called RSV, which is also a common breathing problem, especially for little kids. Both viruses can cause severe respiratory infections, leading to hospitalizations, particularly in young children and the elderly. Both HMPV and RSV are RNA viruses, which means their genes are made of RNA instead of DNA. This characteristic influences how these viruses replicate and spread, making them challenging to control and treat. Scientists think HMPV started in birds and then spread to humans. This zoonotic transmission is a common pathway for many viruses, highlighting the interconnectedness of ecosystems. This happens a lot with viruses that cause breathing problems because birds can carry them. Migratory patterns of birds can facilitate the spread of these viruses across continents. When someone with HMPV coughs or sneezes, the virus spreads through tiny drops. These droplets can travel through the air and infect others, making it highly contagious. Finding HMPV showed us how connected human and animal health are, and why it's important to study new viruses. Understanding these connections helps in developing better strategies to prevent and control outbreaks, ensuring healthier communities. HMPV feels like a cold, a runny nose, coughing, a sore throat, and maybe a fever. These symptoms can often be mistaken for a common cold or flu, making it tricky to identify without proper medical attention. Sometimes it can cause bigger problems like bronchiolitis, pneumonia, or ear infections. These complications can be severe and may require hospitalization, especially in vulnerable populations. Babies, little kids, older people, and anyone with a weak immune system can get really sick from HMPV. Their bodies are less able to fight off the virus, leading to more serious health issues. They're more likely to have serious problems and might need to go to the hospital. Quick medical intervention can be crucial in these cases to prevent further complications. Knowing what HMPV feels like is important so you can get help quickly and not spread it to others. Early detection can make a significant difference in treatment outcomes. If you catch it early, doctors can treat it better. Timely medical care can reduce the severity of the illness and help you recover faster. Pay attention to how you feel, especially during cold and flu season. Being aware of your symptoms can help you take action sooner. If you or someone you know is having breathing problems that won't go away or are getting worse, go see a doctor. Don't wait until it's too late. Early intervention can save lives. Recently there have been many HMPV cases in China, especially among kids. This is worrying health experts and families. We don't know exactly why there are so many cases, but it's probably a few things combined. Maybe more people are getting tested, maybe people's immunity isn't as strong after lockdowns, or maybe the virus just spreads more at certain times of the year. Health officials in China are keeping a close eye on things and are doing what they can to stop the spread, like testing more people, keeping sick people away from others, and teaching people about HMPV. What's happening in China shows us why it's important for countries to work together to watch out for and fight new viruses. Right now, there's no shot to prevent HMPV. Scientists are working hard to develop a vaccine, but it might take some time before it's available to the public. But you can still do things to stay safe, like washing your hands a lot, which is one of the most effective ways to prevent the spread of many viruses, including HMPV. Covering your mouth and nose when you cough or sneeze is also crucial. Use a tissue or your elbow to prevent droplets from spreading. And staying away from sick people can significantly reduce your risk of getting infected. If you're feeling unwell, it's best to stay home to avoid spreading the virus to others. If you get HMPV, the treatment mostly focuses on making you feel better and making sure you drink enough fluids. Things like pain relievers and fever reducers can help manage symptoms. Over-the-counter medications can be useful in reducing discomfort and lowering fever. If you get really sick, you might need to go to the hospital for help breathing. Severe cases may require medical intervention such as oxygen therapy or even a ventilator. Washing your hands often is a simple way to stop HMPV and other viruses from spreading. Use soap and water and scrub for at least 20 seconds. By learning about the virus, knowing the symptoms, and understanding how it spreads, you can take proactive steps to protect yourself. Doing things to stay safe, like practicing good hygiene and wearing masks, can help protect ourselves and our families from HMPV. Stay informed and follow health advice, especially during outbreaks. Keeping up with the latest information can help you make better decisions. Tell your friends and family about HMPV. Sharing information can help everyone stay safe and healthy. If you're worried, talk to your doctor. They can provide personalized advice and treatment options based on your health needs.